What is up, everybody? It's Dr. Vibe here, host and producer of the award-winning Dr. Vibe Show, the home of Epic Conversations, and I'm the host of Epic Conversations, 2020 Best Podcast News Award winner, 2018 Innovation Award winner given out by the Canadian Ethnic Media Association, and I co-host and co-produce the only online show in the world for dads and fathers. It's sponsored by Dove Men Plus Care, and being part of that team, we have reached out directly and indirectly to over 100,000 fathers in 100,000 fathers, dads, and caregivers. Let me get that correct. In 2023, 2021, and 2020. I also am a featured content creator on the Fly Nubian Queen YouTube network that's run by Dr. Boyce and Dr. Alicia Watkins. And that YouTube channel has 570,000 subscribers and growing, and other things around the road. And I like to say thanks for people who are jumping in, and wherever you're jumping in from, please, 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 please say hello, say where you're chiming in from. And as always, I'd like to say you're blessed, highly favored, a magnet for miracles, and a solution for someone's problem. So what are we going to be chatting about today? Well, we have a friend back, a happy friend. She was actually singing before she came on. She has so many talents. She's a very intellectual, beautifully internal and external lady. Plus, she helps run an incredible organization. But she's a No, I was going to say she's a singer first. I know she's going to give. She's laughing in the background. Don't drive. I'm not a singer. I'm not a singer. But let's get down to some business here. There is a big event coming up tomorrow. So we're broadcasting live on the 23rd of February, 2024. But tomorrow, there's a big event happening. So let me share this with you, family. This is a big event. The Black Physicians Association Ontario is having their 15th Annual Health Symposium. I'm just showing you on the screen here. They got keynote speakers. They got other speakers. They got a whole pile of things going on. And I've been very blessed to have this lady on the platform a few times. Last time she was on, she was with a fire person. No, that lady was fire. You remember her? You remember? But she's also fire. And before we go any further, I want to give a big shout out to Anita Wong, who brings these conversations to me. So Anita, thank you so much. Also, I hope we're speaking that your father's going to be better sooner rather than later. Now, let's bring back the main course today. Chenai, how are you?
I'm well. I didn't know I was for dinner.
No. That we appetize with the website, and now you're the main course.
All right. Getting ready to dig in.
Yeah, we're going in today. We're going in. How you been?
It's the day before the big event, so I am just happy to be alive at this point. But I'm also very excited.
Well, that's the thing. As I tell people, I don't use the word nervous. I use excited. Just a different lens. But you know what? There's some people who have probably never seen, never heard, never met you before, especially through a screen. Can you share a little about yourself?
Okay, my name is Chenai Kadungure. I'm the executive director of the BPAO. I am passionate about all things equity. I am lucky enough to be working in my purpose, and I am originally from Zimbabwe, for those who care about heritage side of things, but I also come from a long line of liberators. So I am...
A long line of liberators?
Yes.
Can you give us a little background on one of those liberators?
So my father and his older brother were heavily involved in politics in Zimbabwe. His older brother is actually one of the 6 men that brought independence to Zimbabwe in 1980. So we are a family that cares a lot about freedom and liberation.
Fantastic. Where in your journey did the alignment of health come into your core?
I think it's just a sense of we fight injustice at all points where we can. So in every sector I've worked in, whether it was in entrepreneurship, education, and now healthcare, it's always about where is there an unnecessary barrier? What is standing in the way of liberation for this group of people? So most of the times it'll be working with women, with people, with youth, people who are vulnerable in some way.
Okay. So where did you mention a number of different areas there? When did the health become part of the
Oh, the health.
journey?
Oh, sorry. I would say I started being involved in public health with a small p when I did some work in Care Canada with Care Canada in Malawi. I spent a year in Malawi doing an HIV nutrition project and looking at like the sustainability of the local NGOs there. And then when I was at Skills for Change as an associate director, I was lucky enough to head up the recruiting of all the newcomers who were going to support the vaccine clinics. And then BPAO came a little after that. So I think there's always just been a tie to health since I started working in Canada, essentially.
Okay. Tell us a little bit about BPAO.
Ooh, there's a lot of bit
Well,
about.
we got some time.
So, BPAO, the Black Physician Association of Ontario, the name is misleading. People assume because it's just a physician association, it has nothing to do with them. But we are an organization that is very much plugged into community. And just to mention one of the levels of impact, I remember when I was talking to Minister of Health Sylvia Jones, she actually remembered when I told her I'm at BPAO. She said, "Oh, I am sure your community is happy to know we finally changed the screening age for breast cancer screening, and part of that was because of the advocacy. BPAO has been around since the 1980s, founded by Dr. Miriam Rossi and a lot of her other colleagues. They were involved, Dr. Dominic Shelton, Upton Allen, all the names of the greats. But they then decided to sort of split us up into I think it ended up being like Black Health Alliance on the community side, Taibu, the community health center, so that's the frontline side, and then we are essentially just the sort of clinical expertise. We are always involved with um, any of the sort of community health work that's happening. We've partnered with Ontario Health on the Black Health Plan, so we are proactively working to increase screening across chronic conditions affecting Black communities. So you're looking at diabetes, hypertension, cardiovascular disease. We partner a lot with BHA around, the sickle cell and the mental health pieces as well. But we're just beginning to scrape the surface. There's still a lot to do. So we have a lot of community and medical education sides of things. I've told you a lot about the community things. Medical education side, there's a lot of work there too.
You know what? And I had a live conversation earlier this morning, and one of the things I shared was the more you know, the more you need to know. Just
Mm.
that, what you shared, I didn't know that all those organizations were interconnected.
Yes, we have a lot of similar history, and I think it's because if you think about it, the Black people who came before, and that's one of the things we'll be celebrating in our inaugural gala. The Black people who've come before and have allowed us to be able to do this work have always opened doors elsewhere, and you don't hear enough about that. I don't think people actually know that we have those kinds of connected histories, but our members were heavily involved in the founding and basically organization and running of all these organizations. So they're either sitting at a board level, advisory committee level, that kind of thing. So the history runs deep. I think there's so much that paved the way for us to do what we're doing today.
This is no surprise. You have a fan club watching. Brenda
Really?
Elizabeth Williams says, "Great job, dear. Keep doing what you're doing. Thank you."
Thank you.
And Ingrid Wilson, BPAO and Chennai are essential for our community and for physicians and medical students from our communities.
Yeah.
Ingrid, I want to hail you up, as we say from my
Mhm.
culture. You are a true champion
She is.
for African people.
Yeah.
I just wanted to put it out there, Ingrid.
Yeah.
That is absolutely big time, big time. So I just wanted to make sure I said that.
No, definitely. Let's give people their flowers. Like,
Absolutely.
we can commemorate people later, but while you're still alive, you must know we appreciate you.
Absolutely. And Ingrid says, "I love you, people." Great. So she's on fire. All my people. I love it. Ingrid, we need to get you on the platform. That's long overdue. So I
Yes.
got to reach out to Ingrid and say, what up, Ingrid? Time for you to come here.
She also has a certain nomination that she did announce today that I think you can talk to her about at some point.
Oh,
Yeah.
okay. Well, I think I got her phone number. I'm not gonna digit. I'm gonna make the phone call. And she says, anytime. Okay, be careful what you ask for, Ingrid. We gonna get you here. All right.
The vibes
Good.
are coming.
That's the good stuff. And by the way, people, you may not know this, but when Chenai and I get together, most time we don't have short conversations. So, as a famous Black pastor said, get ready, get ready, get ready. I'm just going to leave it at that. Okay, so what does the BPAO do?
So the best way I describe that is we are proactively looking at issues in Black health. And so we're making sure that communities receiving culturally appropriate care on both ends. We are supporting the clinical side by basically supporting people from pre-med, med student, resident, and physician stage. Like any stage of a person's medical career, we have supports for that. We have resources, networking, training, you name it. And then on the community side, we're involved in projects like the Black Health Plan. Our continuing professional director actually is doing a lipoprotein project right now with community health centers. His team basically discovered that there is a lipoprotein that is common in Black people that increases risk for cardiovascular disease. So,
You're kidding.
yeah, so there's testing.
Wow.
So right now he's sort of like working with the community health centers around like what that testing looks like, because these tests are already available. But I think it's now that we have this new knowledge, there are ways we can proactively look at some of these things. Most people don't know much about family history. A lot of our
Keep on going. I got a very interesting point to bring up there.
yeah,
Go ahead.
a lot of our events will actually equip, you're putting the agency back in the patient to know like what they need to be looking for, the kind of things they need to be asking their doctor or thinking about with their health at different stages of life. We have an amazing community of volunteer doctors who, I mean, I'm sure we talked about the history of this during the pandemic. I think there were less than 40 people administered over 76,000 doses of the vaccine. And so I think that's what I love about the work that I do, that I'm working with people who care in that way. They know that when they're treating community, this could be my mother, my cousin, my brother, and they act like that.
Wonderful. So interesting factoid, you talk about family health history. Well, two really crazy things. First of all, I go to my doctor every 3 months. I don't leave my doctor's office without the next appointment booked.
Okay, you are diligent.
And on top of it, my dad and I have the same doctor.
Yes, I love that.
So when you mention about family medical history, so if there's anything, oh wow, this got questions coming in, but just to continue on here, that whenever my doctor sees anything that is reminiscent of some of the challenges health-wise, he's on it. Proactive.
Yeah, a doctor who cares.
Yeah, and I've had him for over at least 20-25 years.
Yeah.
Because, and I'm sure BPAO would agree with this statement, your health is your wealth.
Yes, absolutely. To me, that's what it is. I told you I care about all things equity, and that's where I've really seen it. Health is just a starting point.
Absolutely.
But I'll also say health is where all of the issues of environment manifest, right? We're big on social determinants of health. So as much as we have a clinical role, we are fully aware, and we always talk about this, or the environmental aspect, whether it's food insecurity, housing issues, all these things.
It's all under the same umbrella.
Yeah. Health is just where it goes to show itself and manifest.
Are you ready for a question already?
Okay.
All right. Shirley, who's one of the regulars on the Morning Vibe and has become a regular on all my platforms, saying, can someone access a medical doctor through the BPAO?
That is the question we get asked the most. And so we eventually created a solution for that. And it is our partnership with the Black Health Professionals Network. They're
Yes.
actually a directory for that. So quite a couple of our members are on that registry, and we're always just kind of funneling people there. So even on our website, on FAQs, that is the answer, because we just saw that there was so much need, but also there is the challenge that there are not many Black physicians, right? And so we need places where people can access them. So definitely that. If someone's not able to find a doctor on that site, sometimes we then do crowdsourcing on our end. But I think BHPN has been a really big solution to that.
Question for you. Do you get more and more requests for Black doctors?
Definitely. I think the more people hear about the difference in experience people have in having, racially concordant care, that's what we call it. I think that's what happens. I think people end up becoming more keen about wanting care from doctors that look like them. I have several friends where, especially with like gynecological things they're worried about, they've just found that, oh, there's a difference when the person actually understands you. There's a I guess there's a different type of care or bedside manner.
Mm,
And I do think I will not argue that all Black physicians are going to give you the best care, but I do believe that because of racial concordance, there are many other, what do I say, many other soft skills or things that are there in terms of just the way you even communicate that I think would make a difference, right? So Black physicians are very burnt out. There are not many of them, and everybody wants to
mm,
work with them, right? So I do think you can get someone on an off day, but I do believe, and the data is already suggesting that in a lot of cases, I think they said for breast cancer, if your clinicians are Black, you have better outcomes regardless of your race.
wow.
That is interesting. Yeah.
Wow. How much, and before we go on a break here, how much in demand has your organization become post pandemic?
The inbox is busy. Inbox is busy. All things Black health. I think people will come to us before they go to even the ministry. They'll be like,
Wow. Well, that's a good thing.
yeah. And so even with working with the hospitals, sometimes we work with hospitals when they're struggling with, what integration looks like, giving better service to community. We've ended up becoming like pseudo consultants for some of these things because culturally appropriate care is not easy. But
Mm,
we are lucky that we have a lot of seasoned physicians with experience in that, whose mandate is that as well.
okay. And Ingrid Wilson, a future guest. Now that she's put herself out there, culturally aware healthcare is a must. Absolutely. Absolutely. Okay, so we're going to take a quick little break because when we come back from the break, we're going to talk about what Shania has nothing to do. She has nothing to do, really and truly. And, she has something coming up tomorrow. She's just sitting back, relaxing, taking life easy. But we'll be talking about the great event that's happening tomorrow. But before we do that, we're going to take a 90-second break. So we're going to keep it locked. And Shania is going to talk about tomorrow night's event when we come back from the break. So keep it locked.
And that's what I feel like. You feel like you're the Harriet Tubman of the mind.
I am.
I feel like I'm one of the Harriet Tubmans of intelligent Black people. Like I want to liberate y'all from like being left behind and ignored and oblivion. No, really, the rappers get all the attention. Seriously, does anybody else feel this way? Like ignorant Black people, they'll be all up, getting all the headlines on the Shade Room.
Overly sexualized Black
Over
folks.
like the twerkers and the just people that don't always represent the best of us, the diversity, like people like Dr. Vibe. Like everybody should know about people like Dr. Vibe. Dr.
really
Vibe he's trying to do good work for Black people.
Dr. Vibe from Toronto, good to see you, my brother. Dr. Vibe, everybody follow Dr. Vibe. He has a great show. He's very good at what he does, and I have a lot of respect for him.
Okay, so let me hop into this. What's up, Dr. Vibe? How you doing? Everybody, if you see Dr. Vibe in the chat, everybody go follow the Dr. Vibe show.
Dr. Bob is a real smart brother and a good human being. I like the guy a lot, and he's very intelligent. And I think everyone should pay attention to what he's got going on. We got to shine the spotlight on the intelligent Black people out here that are really doing the good work. Don't just pay attention to the rappers and the celebrities. You know, a lot of these people are losers. Your true winners are your people in your community that are really having your back. Helping us to have stronger families and a stronger community. So Dr. Bob is in that category. So you might see the Dr. Bob show in this chat. If you see him, please go follow him. Okay. All right. So anyway.
All right. Shout out to Dr. Boyce and Dr. Alicia Watkins. As I said, they've allowed me to put some content on their Fly Nubian Queen network. And that network is actually for Black women. So I host a show with Black women every week. They've allowed me to do that live on their platform. So very happy to have their support. All right, let's get back to some fun things. We got Ingrid's laughing. Ingrid's going to make this a fun conversation. You do it, Ingrid. We got you. We got you. All right. You have nothing to do, Chenai, especially tomorrow, right? You have nothing to do. What's happening tomorrow?
Tomorrow, it is our 15th Annual Health Symposium.
Wow.
Yeah.
Let's go back. What are the origins of that?
It is, how do I say? So for the past 15 years, our members have been getting together and basically updating each other on some of the work that they've been doing and having this as an accredited event where physicians can actually learn about, giving care to community updates and, what some of the sort of like DEI style work looks like. So not just issues around Black health, but also obviously some of the things our Black physicians are busy with. Last year, our keynote was Sean Wharton. This year, it's Jennifer Bernard, another Wonder Woman. And basically, I think it's a great event for anyone who is curious about issues around health. And usually the content is not so heavily scientific. I find that even the layperson can attend these. I learned a lot last year, and I actually wished we recorded last year. But this year, it's our first hybrid symposium. So basically, anywhere you are in the world, you can tune in and you can still sign up for virtual attendance as well. We're going to be at the Mid Sciences building, just opposite Queen's Park, downtown. And it's a packed agenda, and it's an amazing agenda. I mean, you just showed people a bit of what's going to be discussed, but we're talking everything from breast cancer screening, institutionalized sexism and racism in hematology. We're talking vitiligo session, skin of color is what it's called.
No, okay, beautiful. Let's give a little context on each one of these sessions, because I found it fascinating. I want the family here, where they're watching live in the replay, the wonderful conversations and important topics that are going to be spoken about.
Okay. Well, I mean, some of these are the topics I was reading off, though. So I don't know.
Okay. Go ahead.
Yeah. So Jennifer Bernard's going to be talking about changing health via philanthropy, something that we know she is seasoned in. I don't think I've seen anyone ever do better fundraising than I've seen her do in events. So she is queen of philanthropy. And we have Dr. Neil Isaac talking about breast cancer screening. He's actually a BPAO board member, and he's a radiologist at North York General Hospital. So he's going to have amazing things to talk about. He was also one of the vaccinators when we're talking about the 30 doctors who are involved in that project. Dr. Michelle Scholzberg is going to talk about institutionalized sexism and racism in hematology. So I think that those kinds of topics are always very interesting. Every year we have people talking about like, what does racism look like in this space? And so I remember even last year we had DICE do a presentation, and that was Diversity in Cardiology Education, one of the programs that we gave a pilot grant for that's doing amazing work. And then we also have Dr. Yvette Miller Monthrop. She's going to be speaking about skin of color, basically getting into vitiligo and other dermatological issues that Black people face. And the last is Dr. Chantel Phillips. So I'm excited about hers because she's a resident currently in Ottawa. She has been with us probably since the beginning. She's one of those members we've basically been
Wow.
through from mid student days, and she is so engaged, so about community. I mean, she needs to get her flowers even now. For the network of the advancement of Black medical learners, she's done so much preliminary research for us to be able to help improve some of the inclusion aspects of medical education. And I think she's just a ball of fire, so energetic. I think it's going to be an engaging conversation. She's definitely the youngest of all the people on the panel, but I think more people need to hear from people like her as well to actually understand like what it means to have that lived experience as a young person now and having to be part of the solution in that way. And so she's talking about how to better understand and care for Black youth and their health. So I'm excited for all those sessions. We do have a wine and cheese after all of that, and our AGM, where the rest of us get to present the amazing work that's happened as well in 2023 for the organization, because a lot happens. 1 year is like 4 in our organization.
Got you. Got you. That's fantastic. Let me ask, I always love to hear the planning aspect. When did the planning start for this?
You'll laugh, but August, August last year. I think
No, it's not. That doesn't surprise me.
yeah, probably July, but I'd say August is when we had our refreshed CPD committee together. We have 9 or so members of people who are a mixture of physicians, people who work in health, learners, and we ask these questions of like, what does community need to hear now? What is something that is not as prominent out there? And I'd say if you were asking the question about what makes this event unique, it's exactly that. If you're going to a health conference, you're not going to be seeing most of these topics a lot of the time. So I would say if you're interested in looking at what inclusion in healthcare looks like, what proactive inclusion in treatment looks like, that's what these events are great for. We do have another similar mental health CPD event that's going to be coming up in May as well. It's going to be a 2-day event, and that is for everyone who is who's ever needed to assist a patient around anything to do with mental health, and it's trying to get people geared up to give better mental health treatment to community, because there are a lot of do nots that are common. And so with that conference, I mean, we can talk about more about it closer to the time, because I know you're a mental health advocate. I love the work that you're doing with men. That is something that is just needed. So we're looking at a lot of the clinical aspects of mental health and getting people to give better care. Because I think if I had to pick a chronic condition we were probably doing the worst on collectively, it's mental health.
Why do you feel that?
Because I think when you look at even the mainstream data of how everyone else is struggling with mental health, I would say Black community has negative outcomes for a lot of health conditions, but mental health is a place where I feel like there's a lot of red for every other community as well. They're really struggling. If you're struggling to give appropriate care to white people, imagine what the care looks like for Black people. So that's I would say mental health is probably where across the board a lot of work needs to be done.
I want to go back a little bit on the planning aspect of this event. You started last August.
Mm.
Tell me you're not doing this all by yourself, pulling this all together by you. I know you're a Wonder Woman, but sometimes you have to have your kryptonite, okay?
Yeah. So we partner with University of Toronto's CPD department to be able to help us. So they're doing the registration. They do a lot of like the event administration aspects. There's still a lot of heavy lifting on our end, but
Sure.
much better than previous years. I think in the past, to do this event, we needed at least 15 volunteers. But this year we probably are only working with like 1 or 2.
Wow.
So that shows you the difference that having
Yes.
help makes.
Absolutely. That's fantastic. That's really, really good. What for you would make this event a success?
Oh, just for people to talk about impact, people to say, I learned A, B, C, D. For people to also sign up to be able to access the talks later on, because that's something we're doing this year, right? Part of having it virtual is that people should be able to access the modules even after the event. So I would like to hear that people are using it, that people are saying, hey, I actually went and got my first scan after hearing Dr. Isaac's talk. Or, I never considered a career in philanthropy, but then after Jen's talk, so those are the kind of things that to me, those are KPIs that are just in the heart, really. That is what always makes it a success. I already know it's a success in advance, because
Sure.
we don't get so many opportunities to get together, even as a community. So already we've got, I think, 90 odd signups. On average, we get about 120 or 150 people at the event. So for me, it's something that a lot of the people in the clinical community will just have on their schedule every year. But I want to bring in more people as well. So I think that's another success aspect. Like, I think there is value in this event for you if you're a nurse. There's value in this event for you if you're a grant writer in health. There's value in this event for you if you work in a hospital and have to run a DEI department and don't know where to start. Like, I would like to see more people like that. I'd like to see more people want to connect with the work we do. We are a physician association, but we're not only for physicians. That is clear in everything we do. And I just really want more and more people to understand that as well.
Excellent. Excellent. I want to spend the next part of our conversation just talking about some of the, initiatives and programs your organization's going to get done, not looking, they're going to get done
Yes.
in 2024. And I want to start off with talking about the Community Health Center Education Program.
Yes. Oh, so that was the brainchild of Dr. Dominic Selton, one of our esteemed members. Right now, he's the interim admissions dean at TMU, but he's doing a lot of other things, too many other things. We appreciate you, Dominic. But so he was the faculty advisor last year. The program, what it essentially does is for mid students who are looking for experience in community health centers. And I would say part of the idea was because when you're doing medical education in a lot of the schools in Ontario, you're not encountering a lot around Black health. We're working with the mid schools on curriculum being a bit more inclusive, but you're not getting a lot of that. So for people who'd want to work in the future with Black community, this is great because they get to work with community health centers that are serving predominantly racialized communities, right? The CHCs have an amazing role in doing that. And so last year was our pilot year. We had a learner with women's health and women's hands, and she's just amazing. And we would like to see more people take up this program. So that's why we started recruitment a lot earlier this time around. Last year, it was only open to Temerity learners, but this year it's all mid schools in Ontario. Any mid student who wants to be able to have that opportunity can sign up for that program. And it's over the summer, 9 weeks from, I think it's June to like end of July or something like that. And we give you a stipend as well for the time that you're there. So, it's a paid opportunity, and you get to work closely with people at the CHC based on your own, some of your own outputs. You work with the faculty advisor as well on, some of the things they want you to learn about. And then it culminates in a capstone project. So we know for learners, these kinds of experience are helpful for when they're looking for residency. It's helpful for when they're considering if they're going to do it's helpful if they are considering to get into whether it's family medicine or whether, should I be a surgeon? If you're going to work with one of the surgeons there, is it for you? It's a really great place to see like where you belong in the, the health sector pretty much.
Fantastic. How long has that initiative been running for?
It's new. This is only its second year running. We've always done mini versions of that, because in all the wellness clinics and things we do, we always allow mid students and residents to come and support, and we give them honorarium to do that. But this is more about, something more focused, something more long term, really get you into that culturally appropriate piece of it, right? Because there's something about having, the patients knowing you, about seeing how the community health centers are basically, to steal a term from Dr. O's new program, health caring differently, right? That you are what do I say? You're seeing these things of like, what kind of questions should you ask? Because when you are on the mid-school side of it, it's probably a lot more, I don't know how to say it. I don't know how the word. I'll say maybe stiff.
Yeah.
I think that the traditional stuff tends to be, but when you're working with our community, it's knowing that thing, saying, hi, Miss June, how are you doing? Asking different kinds of questions, and also helping community feel more seen and more heard.
Mhm.
So I think the CHCs do that so well. That's why we always partner with them in this work.
Excellent. For everyone, hey, if you like what you're hearing, please subscribe to the Dr. Vibe Show on YouTube and hit the notification button. Also follow the Dr. Vibe Show on Instagram, LinkedIn, and Facebook. And as always, if you want to advertise your business, product, or service on the platform, email me dr.vibe at the drvibeshow.com. So as we continue on, you got things going on with more hubs.
Yes.
What is going on with that? You didn't tell me. You're expanding without telling me.
Okay, we'll invite you to the party, Dr. We'll invite you to so earlier on, we were talking about, community and why that matters to us. We have a lot of members that are beyond the GTA, right?
Yes.
And it's a lot for someone to be commuting to Toronto all the time for our events. And so we thought it was so important for our membership to have community of support out there. So this is mainly centered around the mid schools that we partner with, right? So we've already had 2 hubs launch, the one in Ottawa and the one in Sudbury. So Ottawa, it was, you're looking at University of Ottawa as the nearest mid school. Sudbury, it's NOSM, Northern Ontario School of Medicine. So for London, we are having our next launch on the 20th of March. So people can sign up on the website for that. There's amazing stuff coming out of, people who are at Western. And also, I think there are a lot of like, I guess, like clinics and hospitals in London that we have dotted lines to, we partner with. And so even Jedrin Gugu, who is the Western representative on the Network for the Advancement of Black Medical Learners, he's going to be involved in the event. And we also have someone who's from BMSAC, that's the other organization we partner with, Black Medical Students Association of Canada, Galila, who's going to be involved in us doing that event in London. And what that is that they don't have to always come to Toronto to be able to do something for community, to be able to do something amongst each other. We would like to see more networking and social events, which are essential to Black medical learners, happening where they are. So the London one's 20 March. We have to still start one in Hamilton and in Kingston.
Wow.
As well. Yes. But people are asking. I had someone talking to me about Sault Ste. Marie as well, already saying, hey,
One at a time. One at a time.
No, but we welcome it, because honestly, some of the work we do ends up being like pilot work in those areas. I find it sets off more work. So even some of the smaller grant projects we supported, like Choices, the hypertension project, it's growing, so they're like presenting in Niagara, they want to be able to replicate the model in other places. So I just think that, that's why we want to always grow our membership and grow the scope of what we do, because we really are all over the place, really.
Well, you know what? I'm a firm believer. Find the need and fill it. Don't find the need and kill it. So you're filling the needs, which is really, really important. Just want to shout out some people here. Cassandra Lundgren, Colin Justin Gimrod. I hope I got that name right. If I didn't, it's my head, not my heart. Christy White, Also, Honey La Rochelle, all favoriting, liking the conversation. So this is fantastic. And Shirley, you know, have you hired Ingrid Wilson? I think you need to, because Shirley had a question saying, "Is this true? There's less mortality rates of a newborn babies when the doctor is a Black person." And Ingrid came to your defense, or says, "Yes, Shirley, this is true. There is data out there showing that this follow the BPAO, the Black Health Plan, and the Black Health Alliance for more invention." Shirley says, "Thank you, will do." And Ingrid's laughing. So Ingrid, you're on it. You're on it. You are on it. And Cassandra says, "Loving this. Fantastic." And I'm going to encourage, I've sent the information out to all the platforms. Follow the BPO. Follow the BPO. Make a decision, take action, follow the BPO.
And not just for, like I say, if you're a mid student or anything, but just your own health. There's so much people don't know about what they deserve when it comes to care. And we just hope that a lot of that work is going to, help people figure that out, because there's so much preventable illness out there. So
Well,
much.
you know, I love this. You said deserving it.
Mm.
Are we, I probably, the answer to this question, but I want to ask, why do you feel this is so? What's making this happen? Are Black people not getting the deserved health care that they should have?
I would say yes. I think the outcomes speak to it. Some of it are errors of the past. To give you an example, that there was this race equation called EGFR that was used for diagnosing kidney disease, and the assumptions about the calculations for Black people meant a lot of people didn't get care around that. So people who are on dialysis or are sick with kidney disease, some of them, it could have been prevented, right? But it's just that there were these things where, oh, based on this equation, I don't need to refer you, and things like that. So I think there are a lot of things that we are on the road to correcting, and we're involved in projects that are doing that. But then the other bit is also that not having an inclusive, an inclusive, proactive, targeted piece for Black community. If you see that the outcomes are negative there should be work happening there. So if you have anything and it's just mainstream and it doesn't look at, vulnerable communities, Black, Indigenous, other people of color, you're more than likely going to get negative results continuously. But also, I will say part of it is community doesn't feel safe in hospitals, right? They're places where they've gone and they've left feeling worse than when they went in. And so with what you even said about seeing a doctor every 3 months, for a lot of people, they only go to the ER when something is very, very wrong. That's for them.
Yeah.
That's where they're getting their care. They don't have they're not attached to any primary care physician. So the shortage hasn't helped that, but definitely the distrust from the past, I think, has been part of that as well. So we want more places to hire people that look like us so that people feel safe to come there too.
Ingrid says, "Chenai, I sent Dr. Aaron Smith to you
Yes.
from Sault Ste. Marie to
That's
talk to you."
the one who talked. Yes, I know, Aaron.
And Ingrid is saying healthcare is our human right. And
It
she
is.
says education and awareness are key to protecting our health. Absolutely. Just want to ask, because we always have such epic conversations, whether face-to-face or digitally. We are a few years away from George Floyd.
Mm.
In the interim, there seemed to be a lot of energy.
Mm.
Where from your lens does the energy in regards to Black health from non-melanated organizations stand compared to a few years ago?
I think it's bittersweet, because I think the energy was the highest it has ever been during that time. And I'll always maintain it's because we had, an unwilling audience. Everyone was at home. They had time to listen to these stories and to care. I think there's been a significant change since then. A lot of Black health organizations reported getting like quadruple, almost 10 times the amount of like donations and things like that year. But very quickly it's reverted back. So I think I think the funding aspect speaks volumes of it. Some organizations like ours got to be a bit more well known, and so I think it opened doors. But exactly with what you're saying, that care, I think there isn't really that concept, even though we are interdependent as people, and I firmly believe that. I am African and I'm communitarian by nature. I believe we don't do well as long as someone else is not doing well, right? But I don't think that's a fundamental belief for everyone else. So for some people, it's only 4% of the population. Do we really need to do anything? I think that's a lot of the conversation. There's spaces we work in where people do not want us to explicitly call any programming Black, right? So though there are some of those realities, right, where we say, okay, we're gonna have to, rename it, or so I think there's still a lot of work to be done for getting everyone else to care about Black health. But what I've said about if your care is improved regardless of race across certain conditions, if your care is a Black, to me it makes sense. You want to actually support as much of this racial concordant work and culturally appropriate work as possible, because I also believe that since health is a manifestation of everything else that's not working, once everything else is working, guess what? Less money needs to go to what we do. Less money needs to go to health. But until then, that's what's going to be happening. As long as things are not well environmentally for people, we are going to need people like our members who are doing the proactive work that is required, honestly.
Okay. Another initiative that the organization is working on is the Network for Advancing Black Medical Learners. Tell us about that.
That
this sounds like this is going to be knowledge bombs happening. Okay, I'm ready.
Okay, so this one is exciting because up until Enable started, all of the medical schools in Ontario, I guess, weren't working as much with each other around things like their curriculum or inclusion or anything like that. But there was a survey that was conducted by BMSAC in 2018. Yeah, it was 2017 or 2018. And basically they found out that there are these 6 pillars that are barriers for Black medical learners. So this is something that's going to stop someone from transitioning from mid-school to residency, or from residency to becoming a fully fledged physician. And we see it in our everyday, right? So one was curriculum, what I was saying about curriculum being more mainstream. One was a lack of mentors, right? There were not enough mentors for everybody, but also there weren't enough racialized faculty mentors to mentor some of the Black learners. I think there's something about, people gravitating towards people who are similar to them, right? So a lot of the times the Black medical learners were just left without mentors and having to compete with peers who had mentors, right? There are issues around wellness, right? There's a lot of anti-Black racism in medical education, unfortunately, and that's why there's the need for some of these inclusive practices, right? There were issues around definitely for IMGs, international medical graduates, their challenges around that, right? So that was one of the areas. There were also issues around learner to physician pipeline. So that point where you are either becoming a resident or you're transitioning from residency to becoming a doctor, you needed a bit more sort of not just mentorship, but you needed some structures that help you to actually get to that next place and get prepared for that next place. As an example, most people who end up starting a private practice have probably never learned anything about running a business, and yet effectively that's what you're doing, right? So it's great to see people like BHPN are addressing some of those things as well. And then there is, what pillar am I missing? I've given you how many? 5? Gosh. There's one I always forget, but the pillars are, data collection and learner mistreatment. A lot of institutions are not collecting the disaggregated data. They're not saying our Black learners are experiencing X or doing X. They do more of that now. There's been influence, right? And even on becoming a med student, we partnered with a lot of universities to help them create their Black student application programs, because just from getting in, there were things that weren't being considered, about bringing in more Black learners. So some of those interventions, working with community support at Temerty, basically led to a 10-fold increase of the Black medical learners that signed up there. So I think there are small things people can be doing that help the learner to be able to finish. A lot, I think, is happening at the school level, but when it's residency, it's hard because your residency is at a hospital. Right? So the school does not control what's happening in some of those environments. And so that's where some of us come in, where you have, learners will reach out and be like, I'm just having these challenges. What do I do? Unfortunately, a lot of residents don't complete, especially the more they get into certain specialties. There's just a level of exclusion and some strange hostility that's there. And so we have had to be very proactive about, let's see what we can do. And I will say most of the mid schools are quite engaged in working with us. And I feel some of them are overwhelmed and they're like, what do we do? And so it's great to see a lot of the mid schools are also hiring, racialized faculty and also getting a lot more into inclusion work. So it's a journey, but it's a program that excites us because it makes all the difference. If learners can finish, that's half the battle won.
Okay. I think you're going to give Ingrid an honorary doctorate from the BPAO. She'll be one of the next recipient if you've given someone, or she may be the first. She says, foolishness, culture war, hair color is a must. Yeah. Let me ask, just out of curiosity, do her and Dr. O know each other?
I think they do.
Something tells me I'd love to get them on a show. Oh my, if they were on a show together, that is fire. She puts up. He goes this. Yes. All right. Just want to. Oh, she just says she does. They do know each other. I want to get those two on a show. Oh my. Oh gosh. Them together.
Oh.
Break the internet. Break the internet. Okay. I want to get your lens on a situation that I've experienced indirectly. Ingrid, you're a joker, you know that? She's just having so much fun today. This is good. For those who are watching may not know, we've had an influx of African refugees over the last little while in the Greater Toronto area, etc. And I've been blessed to be able to help do some amplifying for them. So I'm going to give a situation, and how can a BPAO help this individual? This individual's come on. He was a doctor in Africa, and now basically he has to start all over again. What sort of facilities, mentorship, etc.? Because he wants to be a doctor here, right?
So we actually do have IMG resources. I think there's a page on the website where we have some frequently asked questions for international medical graduates. But we also will be launching a scholarship program. The announcement will be coming soon. We have to wait for the funder to announce it on the 29th, so in the next few days. But there will be a scholarship for people who are doing the bridging exams as well. So there are LMICC 1 and Nakoski exams. We are going to be giving some scholarships to people doing that. But we also have, like I say, the mentorship bit is huge. A lot of times IMGs are looking for observatorships. So we actually find out from our membership, like who can come and observe you or shadow you and things like that. Because when you're doing some of those lab exams, there are some differences, right? It's different if you are doing the test even in England and you're doing it here. There are just some things that are specific to here that you'd have to learn about, but you're not going to know unless you get that help. So we have started resources around that too.
So it'd be worth it as well, maybe doing some finding out and getting on the website and doing some. Okay, I will certainly. And now, I don't know. I guess it doesn't cover it, but does your organization do any assistance for frontline Black healthcare workers, especially PSWs?
So some of that will be like what we say with the mental health conference. That will have streams for allied health professionals as well. So we do some events like that. It's just a lot of it is just trying to get the money to do it all.
Absolutely.
They're not enough. I think a lot of people assume you're Black doctors, you have money. Why would you need money? And yet it's like, it's health. So much of what we do, even with those community events we're doing, you're giving, like BP cuffs, glucose monitors, all these different things. There is so much more funding required for the work that we do. And that's part of why we have the inaugural gala coming up as well in June, that I hope we can do a nice blast for. Yeah.
Absolutely. I'm going to ask Chenai, in her opinion, in her lens, what is the state of Black health? Be honest now. I saw that.
The state is not great. I don't think it's great. And I think the best way is for every other person listening, the question is, what is the state of their health? I firmly believe that because of the social and structural determinants of health, there are always going to be challenges. So depending on where a person's working, their health diminishes based on the sector or whatever they're in. I think we had even found out as well that for women, there is an increase of allostatic load, like risk of getting cancer, just from protracted stress. How in this time where groceries are expensive, where people are just struggling to get basic support, what would your health look like? Of course, like I say, it's not going to look great because everything else is kind of working against you. So I think the stress management bit for community is huge, right? But also some of those proactive pieces where they have to find clinicians they trust that they can work with, because most people only find out things when it's too late.
Ingrid says we are in a crisis.
Yeah.
And also says truth. So I asked this conversation piece in regards to the state of Black. What's the state of the Black healthcare professional?
It's not great either. We were currently doing research on physician suicides because
What?
people don't like, there's a lot about these things in the US because they collect the data, but
Sure.
for us, it's, we're not, if something happens, people just say, oh, it's sad, and they'll just say, oh, mental health. But the reality is that Black healthcare professionals will have a whole lot more stress than their other counterparts, right? They're dealing with patients, harassing them all the time. I mean, some of the research that the med schools had been doing had looked at the three aggressors, right? When we're looking at mistreatment, and they had number one as patients, number two was allied health professionals, and number three was, faculty in their programs. So just that alone, I know everyone has been in a toxic workplace at one stage in their life. If what you're doing every day is causing harm, your health can't be great. And a lot of them are still recovering from the pandemic. They work really long hours. I mean, some of our members report sleeping very, very little, like way less than anyone should be sleeping, right? And so we understand this reality, right? The burnout is there, but these are people with compassion fatigue who still have decided to, roll up their sleeves even when they have very little energy.
So then there's a challenge here, because if we want to, it's not at the best of times, it's not a great, it can be a challenging profession to get into.
Mm-hmm.
What can be done to get more Africans in the healthcare professions it's a very challenging profession.
It is, but I think it's definitely this thing of, if not me, then who? I think for a lot of people, it has to be calling. You can't just want to be a doctor because you're like, oh, I want to get paid, or I think your reasoning for getting into it needs to be solid, that like, this is something you want to do. There's a lot of grit involved in it, but I think I would say that to anyone working in the nonprofit sector as well, right? Like, anything that's about caring for community is going to be hard. It's not going to be easy. There are a lot of aspects of the work that's not easy, but it's meaningful, it's impactful, and it's legacy that your children or your children's children, if you want them to have better care than you got, then you need to be involved in some way in this. If you're not in the healthcare profession, then fund or donate to healthcare. Then, volunteer, do, like, this is an all hands on deck. Well, that's what you do in a crisis. There's no, I'm the chef, I don't carry wood or what. No, it's all hands on deck. So
Absolutely. Does your organization do recruiting or encouragement of African people to get involved into the medical profession?
that's our mandate. That's one of our mandates, right? We want to increase the representation of, Black people in healthcare. So we're only about 2.8% of the physician population currently, but realistically, we should at least be at 5% by now.
So I'm going to go in on that. So the majority of those are a number of those people older, younger. Do you see more younger people showing interest in getting involved?
Absolutely.
Okay.
Absolutely. Part of that is because of those interventions, but the other part is increasing that access and exposure, right? I mean, it's programs like Healthcare Indifferently are going to also help that. Most people don't know that's something they'd want to do, right? So I think just be as involved in some of these things. We also partner a lot with the summer mentorship program with Community of Support at Timothy. So they also do summer like learnerships for high school students who want to consider careers in healthcare. Those are things that, push. If you've got a teenager, you've got a child at home who doesn't know what they want to do, like let them just be exposed to some of these things. And again, I'll say the space is getting kinder every year because of the work of people like us. Like if you're part of it, you are going to see the fruit of your labor for sure.
Excellent. Excellent. So I'm not going to keep you for too much longer because you do have an event tomorrow. What would you like? Okay. So what would be your call to action to people who don't look like us when it comes to Black health?
We need allies. I don't think there's anything meaningful that ever happened without like really strong allies. So I mean, we celebrate the corporate allies who support us, but I think everyone else, like I say, has a role to play. Even if you are like, I don't know, a white teacher in school, you need to learn about the opportunities and tell your students about it, those kinds of things. So I think everyone needs to think about where their role is so that they can also start doing some of the work, because this is too big for us to even wait for government to fix. Everyone has a role to play.
Okay. And what is your call to action for people who look like us when it comes to Black health?
Just be as proactive about it. Like attend some of the events. If you're not sure about some of those family history elements, when you see us advertise another, community event, like come and actually speak to one of the doctors. There's so many people who get on the spot care at those events. We've actually had one of our board members operated on some community members who found out that they had cancer and things like that through those initiatives at the event. So I think just make sure that you're taking care of yourself, you're taking care of the people in your family. We've seen a lot around dementia as well in community. We're looking at supporting some work around that as well. The things that are coming up, like speak to us, send us the feedback and say, I'm seeing this happening here. I think we like being responsive to exactly what you said, where the need is. We don't want to create need. Each area has its own issues. So yeah, connect with us, find out where you can.
Well, look, you got some work to do. You always have work to do. But in speaking or sharing with you a number of times, I consider what you do not hard work, but hard work.
Absolutely.
So I want to say thank you for taking time out of your positive, productive schedule to hang out with the family today. The contact information for the organization is here. Also, the symposium information is here. I have shared it out on all platforms. So all you have to do is click or do a copy and paste into your favorite search engine. You'll get what you want. Oh, I wonder if this is... I knew it was Ingrid. Of course. I knew it was Ingrid saying great session. We got your approval. Thank you, Dr. Ingrid. Thank you, Dr. Ingrid. Get ready. I'm coming after you next in a good way. We're getting you on here because I know you got a lot to share. So I would always like to say to you and the organization, don't just manage your time, manage your energy, and remember to give yourself grace. And I'm always here for championing you. So don't be afraid to ask if there's anything I can potentially do for the organization. And also, got to say a big shout out to Anita Wong. Anita Wong. Yes, big up Anita Wong. And Ingrid's laughing. Yeah, we're getting you on this platform, Ingrid. Don't worry. I haven't forgot. I'm going to get you. Do you have any last words you want to share for our audience at all?
Oh, they should come tomorrow.
Thank
And
you.
if not, they should at least sign up to watch the modules.
Yes.
And the gala coming up, we've already got it on the page now. People started buying tickets. Come, bring your friends, and if you are allies, bring even more friends.
What's the date on it again?
15 June at Globe and Mail Center.
Okay,
It's going to be a celebration. No one wants to miss this.
Am I allowed to come?
Yes, that's not even a question.
Is Dr. Ingrid Wilson going to be there?
I expect her to be there. I've already spoken to her about it.
Okay. All right. So thank you so much. I don't want to keep you any longer because, again, I know what it's like to have a big events next day. Oh, by the way, confirmed. Yes. So I don't need to come. If Ingrid's there, I don't
know. Sir.
Sir? Okay, I'm a sir now. I'm not a doctor. I'm a sir.
Listen, we can talk about it closer to the time, but you want to be there. We are honoring pioneers in Black health at that event. You want to come? It's the Harry Jerome of health.
Okay, Harry Jerome Awards. Do you have an MC yet?
It's our incoming president.
Oh, okay. All right.
I won't say the name yet, but
okay.
Yeah.
Everybody comes.
A lot of announcements coming after this weekend.
All right. Well, look, thank you so much. You take care. Again, don't just manage your time, manage your energy. Remember to give yourself grace, and we'll chat soon. Be well. All right. There she is. There she goes. All right, family. There it is. Another epic conversation. What fun. Chenai and I always have fun when we're hanging out with each other. It's always a good time. She brings great energy. All right, family. So let's get some things under wraps here. You can watch replays of this epic conversation on the Dr. Vibe Show, Facebook, YouTube, and LinkedIn, and on my website, the drvibeshow.com. Again, information. There is website, contact information, all the social media handles and website for the organization. There's the link for the gala, but it's already in your comments section. And even if you can't go, sign up for the replay modules. Again, follow the Dr. Vibe Show on YouTube. Hit the subscribe and the notification button. And then finally, follow the Dr. Vibe Show Facebook, LinkedIn, Instagram, and also to advertise your business, product, or service on the platform or any of the platforms I host. Email me dr.vibe at the drvibeshow.com. So how we finish off? This is how we finish off. Live your life as a dream. If you can dream it, you can make it. Sometimes you have to get small to get stronger. Block assumptions and aim bigger, aim better, aim higher, aim wider. Love, faith, and respect. Remember to give yourselves grace and don't just manage your time, manage your energy. God bless. Peace be well. Keep the faith. Walk good.